Hey everyone, it's Josh from Prescription Fitness Physical Therapy and Sports Care here in Geneva, New York. I thought today we'd go over a topic which is somewhat confusing even to us. And this is referred pain. So when we try to understand referred pain, one of the things that may be helpful and that I try to explain to patients is the pain where we feel it very often isn't really where the pain is originating. So common example, when people come in, they complain of pain over the outside of their upper arm. So a lot of people come in, they go, I have pain into my arm, and we try to explain that most of the pain that they're experiencing is actually coming from the shoulder. Most of the shoulder structures, except for maybe the structure right on top, which is called the AC joint, is the source of their arm symptoms, and that the further down the arm the pain travels, the worse the problem is becoming. So to understand that, I think we have the concept of sciatica, which I think is an overused term, and it really just kind of means that I have pain that extends below the knee down to, let's say, my foot or ankle complex, but its genesis is really coming from the lumbar spine. So our shoulder has the same thing, and these follow what are called dermatomes, and a dermatome really is sort of an embryological nerve root pattern. So our dermatomes, when we're developing an embryo, we actually start out as a neural tube. So it's a collection of neurons in a tube, which eventually becomes the spinal cord. And from the spinal cord, develop our arms, and then our legs grow out of this as well. So I try to explain to people, it's sort of, we take a big ball just like this, and we put nerve root levels here. So these represent each one of the nerve root levels, let's say into the neck. So we'll say it's C5, 6, 7, whatever it might be. So if I were to stand inside the ball, so if this were a giant ball or balloon and I were inside this, if I were to push my arms to the side here, what would happen is I would stretch this pattern. It would extend the balloon or the ball outward, and that represents the pattern through which the nerve root travels down into my arm. So if I had pain on the side of my arm here, this follows what's called a C5-6 dermatome, or a C5 dermatome. It's a little bit different depending on which text you're looking at. But pain that's typically over the arm is generated by most of the structures inside our shoulder, which originally were from the embryological level of C5 in that neural tube, and eventually the neural tube again became the spinal cord. So when our brain tries to perceive this, that okay, well, there's billions of nerves in the human bodies, then there's interneurons, which are connections among other nerves. So by the time all this information gets processed and sent to the brain has a tough time figuring out. It says, okay, I don't know really where this pain came from, but I do know that those structures, musculoskeletal structures, were a derivative of this particular level of that neural tube. So I'm going to perceive the pain is coming from there. So if the pain's intense enough, the pain will travel down the arm, and it can go as far even down into my hand. It could go down to my fingers, let's say if we're talking about C5, 6. So a dermatome, complex topic to discuss, but it really is a referred pain pattern similar to sciatica, and this is why, when we have pain here, trust your practitioner that the problem really is coming from here. There are obviously some situations where there could be some issues right into that level from let's say a trigger point standpoint, but most likely it is coming from the shoulder joint. So when they tell you it's that, they're probably right. So if you have more questions on this, feel free to reach out to us at our Facebook site. It's prescriptionfitnesspt.com, and we'll talk to you.